Hey doc, at what age does men's foreskin fall off and go away? Okay. Today we're back at it again, answering medical questions that you are afraid of or maybe a little embarrassed to ask your doctor. Yep, that's right. You guys are always flooding my comments, asking me some really awesome questions, and I figure if one person is wanting the answer, chances are maybe multiple people might be wondering the exact same thing. I can't wait to answer your questions, but fair warning to you all. Sometimes these topics can get a little bit strange and interesting, but today we're not holding back and tackling them all. But before we get into it, I'm Dr. Jordan Wagner. I'm an emergency room doctor. I've created this video series to help answer some of your medical questions and the questions that I get from patients each and every day. If you find this video helpful, please do me a favor and subscribe. All right, let's dive right in. This one prattled me for quite a long time. What is this sand on my eyes that happens to be felt just after waking up so that it irritates me? Is it like tears that vaporized and left salt on my eyes? Good question. When we sleep, right, we're not blinking, our eyes are actually always producing some tears. So what happens is those sand in the corner of the eyes are actually just a buildup of evaporated tears, dust, hairs, different types of mucus, different things that basically the eye produces. But while we're awake, we don't have it because we're blinking, we're moving it. And very interestingly, like the tears actually go down into like the lacrimal ducts that go into your nose. That's why when you cry a lot, you actually have a runny nose, and it's because you're producing all your tears that are actually going down into the nasal passages. Yeah, it's normal, it's safe, you just gotta wipe it away and then you're good to go for the rest of the day. Do farts always contain microscopic poop particles? Yes, to an extent. There was actually a study done a long time ago where somebody actually farted with clothes on and without clothes on, so like a petri dish, and literally without the clothes on, the petri dish grew bacteria relating to the gastrointestinal tracts. So then the question is, are you breathing in poop particles when you're walking around when people are farting all around you? You're probably more at risk of like surface touching of things where people aren't washing their hands after going to the bathroom. Even when you flush the toilet, the aerosolization of the little poop particles is there. So make sure you shut the lid when you're actually flushing the toilets. To answer the question, there are little microscopic little poop particles, but most of the fart smell, it's all related to the gases. And most of the time the gases are related to the bacteria that are in our gastrointestinal tract. Aside from the obvious, what is the hardest place to get a bullet out of somebody? This is always a question asked, and I always tell people most bullets are left alone. There's more damage that occurs trying to retrieve a bullet than actually leaving it in. And then there's always the, oh, it's a lead bullet, would you have lead poisoning? There are rare instances where it is important to remove bullets from the body. So if a bullet is literally in a joint, it needs to be removed. If it's in your CSF, in your brain, it probably needs to be removed. If it's impinging on a nerve, and then typically that needs to be removed by a surgeon who's a specialist at actually doing this. And then another interesting one is the globe of the eye. So what I mean, but if the bullet is in your eye, but you still have function of your eye itself, that bullet needs to get out. So all of those indications are actually all hard to get. Is it true that some males only have one testicle? Is it a serious medical condition for men? Sometimes you can be born without an organ or an undescended testicle, which then can cause issues, and then you lose that testicle, or you lose a testicle due to trauma or cancer or testicular torsion. It's just like a kidney, right? Some people are born with one kidney, or they lose a kidney. Their bodies still function normal with just the one. We have a duplicate system for certain reasons to protect ourselves. That way, if something were to happen, we have a backup, so to speak. Hey Dr. Wagner, I love your videos and I have a question. Is there any serious effects when you headbang? Alright, so I'm assuming you're talking about headbanging to music, like rocker style. Okay, it all has to do with the extent of what you're doing. You can cause yourself a whiplash injury if you're going too drastic. You can potentially cause a nerve impingement. You can potentially cause a fracture of your spinous processes on the back. And then the question ends up being your brain. What are you potentially doing? Most of us who are headbanging are adults, teenagers that are our brains are fully encased by the skull, meaning that there's not much space for the brain to move, so you're not sloshing your brain back and forth. But what happens over time is our brain shrinks. If you're sloshing it back and forth, you increase your risk of what's called ripping your bridging veins. You can cause bleeding, cause something called the subdural hematoma. You just gotta be careful with all these head movements. Bodies are made to understand where we move in space and gives our proprioception of where we are. So if you're messing with it by headbanging a lot, you can potentially cause more long-term damage. Is it true Your eyeballs will fall out of your sockets if you sneeze with your eyes open. No. We have a normal reflex that we close our eyes when we sneeze. Can you fight it? Yeah, potentially. You're still probably gonna blink a little bit, but you're not gonna cause massive trauma, injury. Your eyeballs aren't gonna fly out. Because think about it, your eyeballs are attached in your socket. Right in the back of the eye, it's attached by the optic nerves. And then you have all the muscles of the eyes that are attached. The only time I've ever seen eyeballs coming out of somebody's socket, somebody has a thyroid condition where basically the eyeballs are kind of protruding a little bit, but that's not coming out. If somebody has what's called a retrobulbar hematoma due to trauma where blood is behind the eye and it's pushing out, what's happening in that specific time is it's causing ischemia and you can go blind. So you actually have to do an emergent procedure called a lateral canthotomy to actually allow the blood to come out from behind it so the eye doesn't continue to have so much pressure on it. Back to the original question, sneezing will not make your eyeball pop out. It hurts when I shove hot potatoes up my ass. What should I do? Okay, obviously don't stick potatoes up there. Don't shove anything into the anus that doesn't have a string attached or a flange that you can get it back out. We are negative pressure human beings and it'll shoot up inside and make it difficult to get out. And then you potentially have to go to the ER to get it removed. And if they can't remove it in the ER, you have to get it removed in the operating room. And if they can't get it out by going through the hole that's already there, they have to open up your abdomen and cut out your intestines. So please don't do that. Thanks for your informative channel. My question is, sometimes I get these pimples in my inner thigh where my groin is. When I pop them, pus and blood come out. Is it a pimple, ingrown hair, cyst? Good question. And pretty much like D, all the above. We call them abscesses, usually, if there's pus in it. It could be from an infected hair follicle. It could be a cyst. Sometimes you can have sweat glands on the inner thighs, and you could have a sebaceous cyst where it's actually more of like this cheesy, thick, really bad smelling, where it's like kind of more wormy versus an abscess, which is more pus, which is liquidy, and that can come out. Some people are a little bit more apt to getting these type of skin lesions. If you have continued issues, definitely see a doctor about it. Why can't I burp? I love soda, but it hurts my stomach because of the gas. I'm not sure why I cannot burp, but it's just something that I've never been able to do or have done. It's basically almost like a type of reflex, so there could be multiple different reasons why this individual can't burp. When you drink something, it goes down through the esophagus into your stomach. So once it's in your stomach, you have sphincters, which are basically like valves to prevent things from going back up. So when people are able to burp, you generate gas and then you're able to relax your lower esophageal sphincter, which then allows you to burp the gas out. All right, this is all muscular related. If you're not able to burp, you need to check to make sure you don't have something called achalasia or any type of dysfunction of the esophagus. Just something to go get checked out maybe by a gastroenterologist, but it's not anything particularly life-threatening per se. Hey doc, at what age does men's foreskin fall off and go away? By the way, thank you for your videos. Little anatomy issue here. Foreskin doesn't fall off, doesn't go away. It's a piece of tissue at the end of the male genitalia. We're all born that way. Some people get circumcisions to remove it. But if you don't remove it, it'll always be there. As you actually get older, the skin could potentially get tighter, causing something called phimosis. The foreskin goes over the glans penis and it actually can cause constriction, and then you might not be able to pee. The other issue with having foreskin is something called paraphimosis, where it actually gets retracted too far and constricts the head of the penis and then can cause swelling, and then could need an emergent dorsal slit on the foreskin itself to relieve the pressure versus having a circumcision. There are pros and cons to having foreskin, but it is your personal decision to have it or not have it. But unfortunately, it doesn't just go away and it doesn't just fall off. So if you have foreskin, you're having issues, please see your doctor, see a urologist. I appreciate everybody watching. And as always, if you like this video, check out this video. Make sure you subscribe, turn your bell notifications on. And as always, thank you so much for watching. Stay healthy, my friends.